Getting hair transplant while hair is thinning? At first I thought my hair was completely gone, but when I look closely, I have really small baby hair in areas where it looks bald. I don't know why it does not grow, but I can tell there is small hair and not gone. And now I'm wondering if I should get a hair transplant. Will my hair still fall out, or should I follow some advice I got from a friend and just wait until all the hair that has to fall out falls out and then get a hair transplant? And thank you in advance for any advice and suggestions.
Thank you for your question. You are to be congratulated on making this observation about your hair thinning process, where you're observing that your hair isn't completely gone, but it is thinning. And you're conflicted about whether or not you should get a transplant now or wait till you've lost all that hair. So your observation is exactly what happens with male pattern hair loss. Hair grows in cycles called anagen, catagen, telogen. Anagen is the active growing phase. Catagen and telogen is when the hair rests, and telogen is when it sheds out. When hair comes back, when you have male pattern or female pattern hair loss, the hair comes back thinner. What I'm going to tell you is what we do in our practice for a patient like yourself. First of all, before even considering a transplant, it is very important to understand what the limitations of a transplant are. I think that so many men make hasty decisions to have a hair transplant because they're so desperate to fix the situation about their appearance. Hair loss has a tremendous impact for a lot of men on their self-confidence and their sense of who they are. And so even though the doctor may tell them that hair transplant does not stop hair loss progression, and more than one hair transplant may be required and statistically is likely to be required, they still want to just go ahead and just fix what is going on with them for the now. It's like they borrow from the future. But hair transplants are limited by the mismatch of the amount of hair available from the back of the scalp, that permanent zone that you could see in the baldest man you've ever seen, and the amount that you need to cover in the front. Everyone assumes that when you speak in terms of 1,500, 2,000, 2,500 grafts, that these are big numbers. But when you have a head full of hair, you have over 100,000 hairs. And by the time you notice hair loss, you've already lost half of those hairs. So in our practice, for someone like yourself, our goal is to try to save your existing hairs. Those hairs that are thinning are still salvageable. Now there are two ways to approach this. One is with medical therapy, and that's taking oral finasteride, or the brand name Propecia. This is a drug that stops an enzyme called 5-alpha reductase from converting testosterone to dihydrotestosterone, or DHT. Hairs that are sensitive to DHT genetically will bind to DHT, and it'll cause this progression of thinning. So the concept is lower the DHT, slow down the hair progression in terms of loss. The problem is that not everyone responds to finasteride, and at the current time there is so much concern about the long-term sexual side effects that at least most of the men who come to our practice categorically refuse to take finasteride. It has been kind of a fortunate event for us that over the past several years we've developed a treatment called hair regeneration. And what we have been successful at doing is reversing hair thinning to the point where the results actually exceed, depending on the level of progression of the hair loss, actually the results exceed the results of hair transplantation. Now, how is that possible? It's possible because when your hair is thinning, it's still present. And nature has already created the density that is ideal. So as opposed to a human creating graft sites and then placing hairs, if you were to thicken up existing hairs, you would get much better coverage than you ever could with transplanted hairs. With that being said, it also depends on how advanced you are. In our practice, we have many patients who have really impressed us that even when they are advanced in terms of the degree of hair loss, they've been able to grow a lot of hair back. So we never write anyone off unless they are like what we call a Norwood 7, where they're shiny bald for a long time. Then it's not going to really, we can save the dying, but we can't bring back the dead. It's kind of a concept in that way. This hair regeneration procedure is a combination of extracellular matrix used for wound healing combined with platelet-rich plasma. This is derived from your own blood, and it seems to act as a catalyst to bring in the stem cells necessary for what we believe is a repair process of the hair follicle to restore hair into a thickening process rather than a thinning process. With 3 to 5 years of data, we have so much, and hundreds of patients coming from all over the world, we are very comfortable and confident about the close to 100% success rate we have with men in restoring this hair thinning process, that at this point we actually dissuade people from having hair transplant as a primary procedure. Without the necessity of you taking a pill like finasteride or Propecia daily, and without the necessity of surgery, we've managed to meet in the middle and get a remarkable response. Essentially, it's a one-time injection for most patients. There are some people who I've been doing a secondary injection for, depending on how much hair we're able to bring back and the degree of relative thinness of those hairs that we have brought back. We do see benefit by doing a secondary injection when people are more advanced. So I would say to you, don't wait till all your hair has fallen out. Do something to reverse the hair thinning process. You can, based on what I'm telling you, understand that hair transplant is not the only option, that there is an alternative, whether it's medical therapy or hair regeneration. So learn more about these options before you let all your hair go. So I hope that was helpful. I wish you the best of luck, and thank you for your question.